Hi everyone, welcome to the Durham Women's Summit. I'm Laura Apps and I am a pelvic physiotherapist and the owner of Women's Health Physiotherapy Center. And I'm going to be your guide for the first ever Durham Women's Summit. We're going to be talking to local businesses and local women, local care providers about the things that we need to know about women but we're rarely taught as girls. We're going to talk about the pelvic floor, we're going to talk about hormones, what self-care and self-love really look like. We'll touch on a little bit of practical mindfulness, some tips about the pelvic floor and about pelvic floor physiotherapy and what it really is, and why women should really know more about it. So I want to thank you so much for taking time out of your busy lives to learn more about your body, learn more about your mind, and learn a little bit more about your heart. And remember that all the resources that we're going to be talking to are local, so you don't have to go far from your community to find really good care and the support that you may need. So I hope you really enjoy the summit, and we'll talk to you soon. Hi there, it's Laura Apps from Women's Health Physiotherapy Center, and today I'm going to be talking to you about the anatomy of the female pelvis and the jobs that it do to help us get through our day. So anatomy-wise, we're going to go through the bones and we're going to go through the organs and muscles that make our pelvis work. So starting with the bones, we have your lumbar spine right here. So your low back or your lumbar spine are really intimately connected to everything going on in your pelvis. In fact, there's a very high correlation, as much as a 98% correlation between low back or chronic low back pain and pelvic floor issues. So they very much go hand in hand. These are your iliac crests. So if you were to put your hands on the top of your hips, the bony part that you feel is your iliac crest. And there's a right side and a left side of the iliac crest. And they connect to each other via the sacrum at the back. So if you put your hand on the very base of your low back, it's a hard bony part right before your coccyx or right before your tailbone. Your coccyx or your tailbone sits right here, and it's a tiny little bone right at the bottom of your sacrum. Okay? We have your pubic symphysis, which is this connecting piece right in the middle. Now the pubic symphysis is a cartilage joint, and it can sometimes be a little bit of a bothersome area during pregnancy, but it's the area that joins each side of your ilium together at the front. So if you put your hand right at the front of your pubic bone, the bony part you feel is this area right through here. Okay. We also have at the bottom, they call them your ischial tuberosities. So your sit bones. So again, sitting, if you wiggle your bum back and forth, they're the bony parts that you're going to feel on your chair or if you're sitting on the ground. Okay, so those are the bones of your pelvis. Now, muscle-wise, we have the muscles of your pelvic floor. So your pelvic floor is really everything that sits down here that you see in red. It attaches from your pubic bone at the front, right to your tailbone at the back, and then those sit bones on either side. So everything down here is muscle, okay? The muscles will have a few different functions, and when we're talking about your pelvic floor, it's this area that we're talking about for the most part. Your pelvic floor also comes to the inside of your pelvis, but we'll get to that part a little bit later. So the next area we're going to talk about are your pelvic organs. So those are your bladder that sits right at the front here, right behind your pubic bone. You have your uterus that sits in the middle, and then the rectum that sits in the back. So these organs are very tightly and compactly put into the base of the pelvis and supported by the pelvic floor underneath. So because they're so close together, if you're having an issue with any one of those three organs, you might feel it in different areas. The next bit we'll talk about now is the actual function of the pelvic floor muscles themselves. So again, all the muscles we can see down in this area, and they also, I move these parts out, wrap around the inside of the pelvis underneath where the organs would be sitting. So all of this that you see in red, those are muscles. So we consider them to have 5 S's or 5 functions of your pelvic floor muscles. The first being sexual function. So you need sufficient strength of the pelvic floor muscle for pleasure and for orgasm. And you need excessive tension can actually cause discomfort or pain for some women during or after intercourse. So we want to have a happy balance of muscles that are not too tight, but also strong enough. The muscles are also a support. So they're going to support all of the organs that sit, we were just talked about, that sit in the middle. The pelvic floor muscles are like a basket that support your organs, your bladder, your rectum, and your uterus, against gravity and excessive pressure from your abdomen. When you strain your pelvic floor muscles during pregnancy, or with weakening of the pelvic floor during pregnancy, or for some women during menopause or with hormonal changes, the pelvic floor organs can start to drop into the base of the pelvic floor. So if there's not enough support underneath, the organs that sit on the top will start to sag a little bit. It's something we'll call pelvic organ prolapse. The next part is sphincter control. So that's the third S. The muscles of your pelvic floor act to open and close your openings when you want them to open and close. So they act to control the urethra. So that's where the pee comes out, right at the front. If the muscles around the urethra are not nice and strong and doing their job well, when you cough or you sneeze, you might leak a little bit. Your other sphincter is the rectum at the back. So again, we want these muscles to be able to control when we want things to close, and also to relax when we want things to open. Right? So the muscles contract around the urethra and the rectum to prevent leakage, but they're equally as important to have these muscles lengthen to allow urination and bowel movements. Okay? There's a sump pump action of your pelvic floor. So just like your calf muscles can relieve a little bit of swelling in your feet and ankles, some might notice it during pregnancy a little bit, the muscles in your pelvic floor act to move fluid throughout your pelvis and actually throughout your body. There's a lot of lymph that sits in these areas, and if the sump pump action of the muscle isn't working really well, you can end up with something called pelvic congestion, or actually even swelling into the pelvis and the perineum. The last and one of the most important kind of functions of your pelvic floor is stability. So because of their attachments to the pelvis and hips, the pelvic floor muscles have a really important part in the core. These muscles assist the abdomen and the hip and the back muscles to control movement of your joints, so your SI or your sacroiliac joints, and your pubic symphysis, and your hip joints right here. These are your hip sockets. If you're trying to strengthen your core, your pelvic floor should be a really an integral part of your training program. It doesn't act alone. Everything has to work together in order for the pelvic floor and the core and everything that attaches to all of these areas to work really, really well. Okay, if you think you're having a problem with your pelvic floor or could benefit from physiotherapy, please reach out. You can find us at Women's Health Physiotherapy Center, and we have a few different physiotherapists who are trained in pelvic floor assessment and treatment, and we'd be more than happy to see you. Thank you guys for watching, and hopefully this has been really informative, and you have more information about your pelvic floor.